This year, the EHA have come up with a new educational format called Topics in Focus. And yesterday, there was a kick-off session around immunotherapy, focusing on CAR T cell therapy. Well, I'm delighted to be joined by one of the chairs of that session, Professor Marie-José Kersten, who joins me now. Welcome, and thank you very much for joining us. So, can you tell us a little bit about the Topics in Focus program, and particularly immunotherapy, and why CAR T was so important?
Right, yes. So this is a new concept originating from EHA, and the goal actually is to increase the knowledge for the practicing hematologists and scientists in the field of immunotherapy. I think the whole idea is that for the coming 2 years we will have several activities like educational sessions, educational materials on the website. And the whole goal is to increase the knowledge for this exciting new field of treatment.
And what other kind of activities can we expect in the program itself?
Yeah, so we had the kick-off session yesterday, which was with 3 talks around CAR T-cell, especially also on how to make this happen in Europe. I think in Europe, actually, there's not that much experience yet, so it's very important that the centers that are planning to do CAR T-cell treatment know what they're getting in for, because it's an exciting type of treatment, but it also carries some risks, and it's important that the physicians that treat those patients know of these risks and how to handle them. So we foresee maybe some training program. There will be a whole 2-3 day session on immunotherapy in February, and there will be educational material on the website.
That sounds great. And thinking about yesterday's session specifically, what were the main take-home messages from a clinical viewpoint, or in terms of organisation, or anything that you thought was really salient?
Yeah, so I think there's still a lot to, the message was that there's still a lot to be learned. We've seen some great responses both in acute lymphoblastic leukemia and in lymphoma, but we've also seen that there's a lot of challenges around this treatment to make it really make it happen, and to really tackle all the logistic and management problems. A lot more needs to be done, and also there's still limited experience, and we will need real-world experience to really find out what the place for this treatment is.
What were the main sort of discussion points that came up?
Yeah, so some of the discussion points were should you be doing this in any kind of hospital? Or should it be done in selected centers, and who gets to decide where the treatment is given? At the moment, actually, both the FDA and EMA mandate that the hospitals where CAR T-cell treatment is carried out are certified or qualified. They have to have their procedures in place. Yeah. So we had some discussion on whether or not that should be, for example, JC accredited stem cell transplant centers.
Yes, I thought it was a really good discussion yesterday, and it was opening up, and we could have gone on for hours, couldn't we? What do you think the next kind of activity on this program might be?
Yes, so I think actually, you know, EHA is a huge organization with thousands of members, and I think we should collaborate more and form networks of centers that have experience, and then those centers could help centers that are starting up with new immunotherapies, and we could then increase the knowledge much faster, and also with innovative modalities of educational materials. I think a lot can be done there.
Yeah, absolutely. So spreading the word.
Spreading the word and spreading the knowledge and helping each other. I think that's very important.
And you mentioned there'll be some other activities. What do you think the next activity is likely to be in this program? Yeah.
So we're working on the educational material, so it will be a combination of videos and texts, of course, but also we're thinking of new concepts, for example, serious gaming. I think this is a subject, the management of toxicity, which could be translated very well into a serious game where you actually have patient cases, and then you get to decide what you do for that patient, and we're working on that right now.
That all sounds great. Well, Professor Kersten, thank you so much for joining us, and good luck with the program.
Thank you.
Thank you.